cardiac sphincter, pyloric sphincter, rugae of the folds, greater curvature, lesser curvature, the smooth muscle. Okay, so this is the, I don't know how you want to do the numbers, but 20 is your longitudinal.
No, don't worry about the numbers. Just
circular, oblique. Okay, so the outer layer is the longitudinal. Next underneath it is the circular. Underneath that is the oblique.
Okay, if we were to be tested on that, would you do one on a model that will show that it's a third layer or second layer, where we can see that there's
Yeah.
Okay.
I mean, this is the only one that I would. This is the only one that's crystal clear. There's nothing else that I have that compares to this, because this shows the depth of them.
Perfect.
Okay, so the only one I'm going to use muscle layers is this one for the stomach. Okay. Connecting to the stomach, we obviously have the duodenum or duodenum. We have the hepatopancreatic sphincter, which shows really good on this one because it has the hepatic part and the pancreatic part coming together. So that's the hepatopancreatic sphincter, okay, or ampulla. Somewhere in the middle is jejunum here. The duodenum's not very long, but we have jejunum in the middle, and then eventually whatever comes to the end. I know this is ileum, I know this is duodenum, jejunum somewhere in the middle here on this model. Okay. Plicae, circularis are the folds there. Large intestine, we have the ileum coming in here. It goes to the ileocecal valve, goes into the cecum. We have the variform appendix, or the appendix branching off of that.
Show the ileocecal valve.
Ileocecal valve right there.
Thank you.
Okay, we have the appendix, we have the ascending colon, we have the right colic flexure, the left colic flexure. This one's by the liver, this is by the spleen.
Transverse colon going across
transverse
the center.
colon missing, descending colon. This white line here is Taenia coli. These pleats are hostra, so from the inside or outside, it's kind of billowed out like a balloon. We come down, we make an S curve here, which is sigmoid colon, allows us to pass gas without pieces. We have the rectum. The musculature is different in the rectum. Hostra, Taenia coli, liver, see separate model, pancreas. This is on the pancreas here. This is the duct of Wirsung, which you do have. I mentioned that today, and I think everyone looked at me like, what was I talking about? Okay, so the duct of Wirsung, this happens to be the duct of Santorini. They come into the pancreatic duct.
Is that the accessory duct?
Yeah, the accessory duct, the other name for it. Okay. I don't know if you have it on. She might have just mentioned it. It's not on your list, so I'm not going to ask that. On the this is on that big color. Oh, here we go. On this one here, you have a capillary bed, which is all of this stuff here. This is all capillary bed. The lacteal is the green thing in the middle. The muscularis mucosa is this layer, which is from this up is mucosa. You have the lamina propria, which is all the gray stuff is the base tissue holding this. The villi are these little tiny things here. These cells have microvilli on it. These villi are, you can see them. They're not microscopic. The microvilli on the cells would be microscopic. The goblet.
I think she had columnar epithelium for the...
Or the yellow cells.
Yeah, those are columnar epithelium. In fact, they're biliated columnar epithelium.
Okay.
Okay. Crypts of Lieberkühn are these folds here. There's some beautiful ones on the side here, there. Paneth cells are the intestinal glands at the base of the crypts of Lieberkühn. In the submucosa, you have the mesenteric arteries. Okay. You have Brunner's gland, which is this. You have a lymph node or Peyer's patch, this. You have the submucosal nerve plexus. Something has to control these muscles. Okay. Nothing, when we take a look at this, nothing has to control that, but we have to control that muscle layer. The muscularis externa includes both the circular and the longitudinal layers. So this together is the muscularis externa with the circular layer and the longitudinal layer. We have a nerve plexus that controls those, the mesenteric nerve plexus, and we have a serosa layer, which is the outer layer.
What would you ask for the nerve plexus?
Myenteric, I think, is on the serosa.
Yeah, you have myenteric nerve plexus. So
perfect. Thank you.
Okay. You have on this something. You have a gallbladder. Coming out of the gallbladder is the cystic duct. Okay? You have a right and a left hepatic duct. Okay? Comes together to the common hepatic duct, which is from my finger to that little short segment right there is a common hepatic duct. From there forward is a common bile duct.